You are certainly an expert in hormones. Let's talk about birth control pills for a little bit. Obviously, very effective in preventing pregnancy. A lot of other women take them to control periods. What about long-term use?
As an OBGYN, I prescribed a lot of birth control pills, and you know what, Scott, this is a subject I've become very passionate about. I'm very against the use of birth control pills now. I was a birth control pill user for much of my life, and what really I have come to find out in many years of additional study in hormones is that birth control pills completely take over and change a woman's hormone chemistry. They block our body's own production of natural hormones and take over with these artificial hormones, especially the artificial form of progesterone known as progestin. That's most birth control pills are made of an estrogen component and then what they call a progestogen component. And the progesterone component is never made of progesterone, which is the hormone we naturally have in our body. It's made of an artificial form. And that artificial form can come with a lot of side effects and negative effects, including even the increased risk of breast cancer and heart disease. And those are very concerning. But I think for me, the thing that was most personally concerning was I lost my sex drive, my libido, at age 28 when I was only married for 3 years. Not a time in your life where you expect to lose your libido, right? Well, it just so happens that birth control pills, taking oral estrogens by mouth, increase a protein called sex hormone binding globulin. So it does just what it sounds like it does. What it does is it binds up our sex hormones, particularly testosterone. So what happens is when SHBG is what that protein is called for short, sex hormone binding globulin, when that goes up due to taking estrogens, free testosterone goes down. That can cause some women major trouble with their libido. And it can even go so far as to dry out, cause vaginal dryness, and even sexual pain. One of my dear friends, Dr. Andrew Goldstein, an OBGYN who specializes in vulvar issues, he states that one of the most common reasons he sees for sexual pain is the birth control pill. When he sees sexual pain in a young woman, first question is, are you on a birth control pill? And Scott, this can be devastating. I had a woman in my office recently, Denise, and she was on birth control pills from age 15 to age 45. And she comes into my office seeing me at age 46. After having gone off the birth control pills, she had seen some videos that I'd done and heard what I had said about that. And she came in and we talked about sex drive, and she said, you know, I've just never had a sex drive. It was never the way that my friends all talked about it and made such a big deal about it and orgasms. And she's like, I've never experienced that. And I have this new man in my life, and I'm really keen to experience that. I really want to have this experience. And we talked about the fact that birth control pills probably played a big role in what was going on for her. And she just bawled. She just cried and cried. And my heart goes out to her because that is what can happen, unfortunately, with birth control pills. It can rob women of their sexuality, and it can cause so many other different symptoms for women. And so I don't really think that should be the go-to. And the even worse part, to compound everything else I've told you, is that sex hormone binding globulin, when it goes up to a very high level with women on birth control pills. The really unfortunate thing is what we're finding now in studies is that even when women stop the birth control pill, the levels can stay elevated. Not quite to that high level as when a woman was on the birth control pill, but never back down to the low level that they might have experienced, or at least in one study, out to a full year. Women sustained that high level, meaning a very low level of testosterone. And that can take some specialized care to overcome. Luckily, there is testosterone therapy replacement, and I do that with my patients. So that is an option for some of these women. So women should know there are options for them. I'm not saying it's hopeless, but really not getting on a birth control pill to start with would be my advice. And the next natural question is, so what do you recommend? Yeah. An IUD. I recommend the copper IUD. It lasts for 10 years. It's an excellent form of birth control, and it's more effective than taking the pill, and it doesn't have any of these hormonal side effects. The copper IUD is hormone-free, and that's what I would recommend for women.
What about for the women that want to control their periods. I mean, that's a big reason for birth control pills as well.
You're right, Scott. Birth control pills, irregular bleeding is a big reason that birth control pills are prescribed. I completely disagree with that as well. When women are having irregular bleeding, that's a sign of hormone imbalance. And it's very important to realize that that is a sign of hormone imbalance. Irregular bleeding is clearly a sign of hormone imbalance, and it should be investigated by a hormone specialist. A woman who has irregular bleeding and symptoms like that that would prompt them to want to take a birth control pill should trigger an evaluation to see where a woman's estrogen is, and particularly where her progesterone is, particularly in the second half of the cycle. That tends to be a time where some women don't produce enough progesterone. And when a woman's not producing enough progesterone in the second half of the cycle, that can cause irregular menses, heavy menses, irregular menses, all kinds of issues for which a gynecologist may use birth control pills. And of course, I did. This is what I was taught as a traditional gynecologist, but having since done a lot of additional studies in hormone therapy and extensive reviews of the scientific literature, what I find when I treat patients is if I give them a little bit of natural progesterone, just the hormone progesterone, if they have an inadequate progesterone level in the second half of their cycle, I give them a little bit of progesterone supplementation. Sometimes all of those symptoms just even right out, not to mention the PMS that they may be experiencing that goes along with it. Because they certainly don't have a deficiency in birth control pills. They have a deficiency maybe in progesterone, because progesterone is not only controls the cycle, but it can control a lot of the mood symptoms and psychological symptoms that go along with having irregular cycles.